Hi everyone, my name is Tashara Smith, and this presentation I'll be discussing the general surgery procedure, laparoscopic colectomy. I will explain the purpose of the surgery, the anatomy involved, and four surgical instruments from my kit, including their function, category, and how they are expected in sterile processing to ensure patient safety. Laparoscopic colectomy is a minimally invasive surgery where parts of the colon is removed. It is commonly performed to treat colon cancer, diverticulitis, bowel obstruction, or diseased tissue. Small incisions in the camera are used instead of one large incision, which helps the patients heal faster and reduces complications. The colon, also called the large intestine, includes the ascending, transverse, descending, and sigmoid sections. Its job is to absorb water and form waste. During a colectomy, the surgeon removes the diseased portion and reconnects the healthy ends of the bowel. First, small sections are made and the abdomen is inflated with carbon dioxide gas to create working space. A camera and instruments are inserted through ports. The surgeon then dissects tissue, controls bleeding, removes the affected section of colon, and reconnects the bowel before closing the incisions. These are Maxim scissors, which are in the cutting and dissecting category. They are used for delicate tissue dissection and cutting soft tissue around the colon. During sterile processing, I would inspect the blades for sharpness and alignment, check the box locks for smooth movement, and make sure there is no corrosion or debris that could affect performance. These are hemostats, which is used for clamping or occluding blood vessels to control bleeding. During surgery, it helps maintain a clear surgical field. When inspecting, I would check the ratchet to ensure it locks properly, inspect the serrations and tips for alignment, and look for cracks, rust, or damage. These are tissue forceps, which fall under the grasping and holding category. They are used to handle tissue or sutures during the procedure. In sterile processing, I would inspect the tips and teeth for alignment, make sure they are not bent, and ensure there are no burrs or rough edges that could damage tissue. This is a needle holder, which is used for suturing and closing incisions or reconnecting tissue. It securely holds the needle while stitching. During inspection, I will check the ratchet function, examine the jaws and inserts for wear, and make sure it grips properly without slipping. These instruments work together throughout the procedure. Scissors cut tissue, hemostats control the bleeding, forceps hold tissue, and the needle holder is used for suturing. Each instrument has a specific role that helps the surgery run smoothly and safely. Sterile processing professionals are responsible for cleaning, disinfecting, inspecting, assembling, and sterilizing these instruments. Proper processing ensures they function correctly and prevents infection or surgical complications. Inspection is very important. We check for cleanliness, damage, sharpness, alignment, and proper function. Instruments may also be lubricated and tested to make sure they open, close, and lock correctly before sterilization. In summary, a laparoscopic colectomy is a minimally invasive procedure used to remove diseased sections of the colon. The surgery requires several instruments to cut, clamp, hold, and suture tissue effectively. From a sterile processing perspective, it is our responsibility to make sure every instrument is clean, properly inspected, functional, and sterile. If an instrument is damaged or not working correctly, it could delay the procedure or put the patient at risk. This shows how important sterile processing is in supporting the surgical team and protecting patient safety. These are the references I used to guide my understanding of the procedure and sterile processing standards. Thank you for watching my presentation on laparoscopic colectomy and surgical instrumentation. This assignment helped me better understand how surgical instruments function and how sterile processing directly impacts patient safety. I appreciate your time and I'm happy to answer any questions